Many people are convinced that medical checkups are an unconditional good. But what if I told you that after a certain age, some of them can pose a real threat to your life? This may seem paradoxical, but the fact remains, not all examinations and tests are harmless. Moreover, some of the most common screening procedures offered to older people can lead to false alarms, unnecessary stress, and even dangerous medical interventions. This is not an attempt to sow panic, but a statement of fact that more and more doctors are beginning to realize, especially when working with patients over 70 years of age. The medical community is gradually coming to an understanding of a new reality. A universal approach to testing can do more harm than good when it comes to older people. In this material, we will take a detailed and unbiased look at 5 specific medical examinations that older people may want to avoid. These are examinations that even experienced doctors often refuse for themselves. We will analyze why these tests are so often recommended, what hidden dangers they hold, and what more reasonable alternatives exist so that you can stay informed about your health without exposing yourself to unnecessary risk. You deserve medical care that respects your age, the characteristics of your body, and your quality of life. If you're a person who genuinely cares about your health, but at the same time seeks to avoid excessive treatment, excessive medication, and the overload of the modern healthcare system, then this information will be useful to you. We do not aim to scare you. Our task is to provide you with knowledge, strengthen your confidence, and help you form a clearer understanding of what is really necessary to maintain your health after 70 years of age. So let's begin. The first point is the colonoscopy trap. Colonoscopy has long been considered the gold standard in the prevention of colon cancer. However, after 70 years of age, especially in people who do not have any symptoms or a burdened family history, this test can subtly turn into a source of more harm than good. What was once a life-saving examination in your 50s or 60s can, after a certain point, become a cause of unnecessary risk, stress, and even hospitalization. Why? Because the procedure itself is not a trifle. It involves complete bowel preparation, sedation, and the insertion of a probe deep into the colon. This may be quite tolerable for a young adult, but for older people, the risks increase significantly. The bowel cleansing process alone can cause severe dehydration and electrolyte imbalance, which is especially dangerous for older people. And the sedatives used during the procedure can linger longer in an older person's body, leading to confusion, dizziness, and an increased risk of falls. But there is something even more worrying. Many older people, especially those over 75, undergo subsequent surgeries or treatments after a colonoscopy. In this case, a small polyp is discovered that may never have caused harm. These slow-growing abnormalities often take 10 to 15 years to develop into something serious. And for a person aged 70 or 80, these years may never play any role. Nevertheless, the very discovery of a polyp causes fear. It triggers a whole chain of procedures, biopsies, repeated examinations, and even partial removal of the intestine, all in the name of prevention. But when the risks of these interventions outweigh the potential benefits, prevention turns into harm. Here is an example that I will never forget. My friend George, 82 years old, active and sharp-minded, was persuaded to undergo a routine colonoscopy, even though he had no digestive problems. During preparation for the procedure, he became severely dehydrated. After the colonoscopy, he was stunned and confused, fell at home that night, and broke his hip. This single test led to months of rehabilitation, huge medical bills, and severe stress. And you know what? The examination found nothing. This is not about blaming doctors. They're doing what they were taught. But medicine is evolving, and we must evolve with it. If you are over 70 and are not experiencing any symptoms, it is perfectly reasonable to refuse a colonoscopy. There are now non-invasive stool tests that are safer, simpler, and more effective for many. It's about weighing the true cost, physical, emotional, and financial, of subjecting your body to something that may not actually help. We must stop assuming that more tests always mean better service. Because after 70, better service often means fewer interventions and more thoughtful choices. By being careful, You are not neglecting your health, but, on the contrary, honoring it. The second point is the mistake of annual full-body scans. There is something tempting about the idea of a full-body scan. When a machine scans you from head to toe, detecting every hidden problem before it becomes serious, it sounds like a reasonable preventive measure, doesn't it? But for older people over 70, this approach may be more of a curse than a blessing. Although the intention behind a full-body scan may seem quite reasonable, the results they produce often trigger a domino effect consisting of fear, invasive tests, and even unnecessary surgeries that can shorten your life rather than prolong it. Let's be clear, full-body CT and MRI scans are not ordinary screening tools. These are powerful technologies designed to identify everything, and I mean absolutely everything, including harmless abnormalities that will never affect your health or lifespan. These so-called incidental findings can turn into time bombs in your mind. A small nodule here, a shadow there, and suddenly you find yourself on a carousel of follow-up appointments, biopsies, and consultations with specialists, all in pursuit of something that may never have mattered. Why is this more important after 70? Because an aging body does not react as it used to. A biopsy that would be a simple procedure at 45 can now lead to lung collapse, infection, or weeks of recovery. Even something as ordinary as lying still during an MRI can be physically tiring or painful for older joints. And, of course, we must not forget the emotional losses that many keep silent about. Older people often bear the burden of worrying about what might happen instead of enjoying the health they actually have. Take, for example, Betty, a 78-year-old woman I met at a senior health seminar. She was energetic, walked every day, and had no health complaints. But at a health fair, a mobile clinic offered her a full-body scan at a discount. The result was the discovery of a tiny lesion on her kidney, so small that it caused no problems and probably never would have. But the single word lesion was enough to cause panic. Within a month, she had surgery. The consequences: months of recovery, a significant decrease in energy, and persistent complications that never went away. And all because of something that could have gone unnoticed forever. From a medical point of view, this is called overdiagnosis. From an emotional point of view, this is called unnecessary fear. And from a financial point of view, it is simply devastating. Full-body scans are rarely covered by insurance, and, unless there is a clear indication, many older people end up paying out of pocket, thinking they are buying peace of mind. But in reality, they are buying a ticket into a system that may never stop testing. At this stage of life, responsibility looks different. It lies in trusting your body a little more. It means listening to your feelings, not just what the machines say. And it means recognizing that not every shadow on the screen deserves your energy or your fear. The third point is the overuse of cardiac stress tests. For decades, the treadmill stress test has been considered the primary method for detecting heart disease, especially in older people. The logic is simple. Load your heart and see how it reacts under pressure. But after 70, this logic can have unpleasant consequences that many older people are unaware of until it is too late. What was once a useful tool in your 50s and early 60s becomes a questionable and sometimes dangerous procedure once you cross a certain age threshold. The reason is that cardiac stress tests in older people often produce what doctors call false positive results. This means that the results may indicate that you have heart problems, when in fact your heart is working perfectly normally. These misleading results occur because our bodies naturally change with age. Arteries become stiffer, blood pressure fluctuates more, and electrical patterns in the heart shift. None of this necessarily indicates disease. But the stress test does not take this into account. It simply sees something unusual, which can trigger a cascade of fear and further research. This cascade may include angiograms, catheterizations, and in some cases, even stent placement or bypass surgery, all of which carry real risks. For older people, these risks are not insignificant. We're talking about bleeding, kidney damage from contrast dye, and a dangerous drop in blood pressure. After surgery, it becomes more difficult to recover, and complications occur more often. What starts as a simple treadmill test can end with you in a hospital bed, wondering how it all happened. Let me tell you about George, a 74-year-old retired bus driver. He had no chest pain, shortness of breath, or fatigue. He simply came for a routine checkup, where his doctor, just to be safe, ordered a stress test. The results were borderline, and the next moment he was referred to a cardiologist. 3 weeks later, he had angioplasty for a blockage that was not causing any symptoms. Within a month of the procedure, George developed a severe infection at the catheterization site. He ended up in the intensive care unit and spent the next 6 months in a rehabilitation center. His quality of life never fully recovered. Now ask yourself, was that treadmill worth it? The truth is that many leading heart specialists and geriatric associations now do not recommend routine stress tests in older people without symptoms. They agree that if you have no symptoms such as chest pain, shortness of breath, or unexplained fatigue, then there is often no benefit, and the potential harm is quite significant. This is especially true when your goal is not to live forever, but to live well. From a psychological point of view, there is something very compelling about the idea of checking your heart. The heart seems to be the central organ that defines who we are. It is the drumbeat of life. Therefore, it is natural that we want to make sure it is healthy. But this is where wisdom comes into play. Healthy aging is not chasing every tiny potential problem. It is listening to your body, maintaining your independence, and avoiding the medical overdoing that can take more than it gives. This does not mean that you should ignore your heart health. Not at all. But instead of jumping on the treadmill in the doctor's office, focus on the basics: daily walks, a balanced diet, maintaining social connections, and managing stress. This is what really supports your heart after 70. Not machines, not wires, and not tests designed for people half your age. Most of all, at this stage of life, we need insight, the courage to say no to something just because it is available, and the wisdom to understand that not every test is a gift. And sometimes refusing a test is the most life-affirming decision you can make. The fourth point is the pitfalls of routine colonoscopies. There is something alarming about the idea of colon cancer. It creeps up often without any warning signs, and by the time symptoms appear, it may seem too late. That's why for many years, colonoscopies have been praised as one of the most important preventive tools in modern medicine. But here's the reality. Many people are not told that after a certain age, especially after 70, the risks of colonoscopy often outweigh the benefits. And for some older people, this test can do more harm than good. Let's start with the procedure itself. Colonoscopies require full sedation. And for older people, anesthesia carries serious risks. Your liver metabolizes drugs more slowly with age, and your brain becomes more sensitive to the effects of sedatives. That's why older patients are at greater risk of so-called postoperative cognitive dysfunction. This is a fancy term for persistent confusion, memory problems, and brain fog that can last for weeks or even months after the procedure. Then there's the bowel preparation. If you've ever had a colonoscopy, you know what it's like consuming large amounts of powerful laxatives that flush your system. But for older people, this process can cause dehydration and exhaustion. It disrupts your electrolyte balance, impairs kidney function, and can leave you feeling exhausted both physically and emotionally. One wrong step, and you're dizzy, tired, and maybe even falling in the bathroom in the middle of the night. This is not an exaggeration. Falls associated with colonoscopy preparation are more common than people think, especially in older people who live alone. And yet, perhaps the most overlooked question is the time horizon of benefit. Colonoscopies are designed to detect slow-growing polyps that can develop into cancer over 10 to 15 years. But if you're already 70 or 80 years old and have had previous clean examinations, the chances that these polyps will turn into something dangerous in your remaining years are extremely low. In fact, many medical associations now say that the potential benefit becomes negligible, while the likelihood of complications such as bleeding, perforation, and adverse drug reactions increases significantly with age. Take the case of Eileen, a 78-year-old retired teacher. She had a clean colonoscopy at 68 and again at 73. But at 78, her doctor suggested another one. just to be safe. She agreed. During the procedure, her colon was accidentally perforated, which is a rare but serious complication. She had emergency surgery and spent almost a month in hospital. Eileen survived, but she never regained her former energy, and her independence diminished. She often says that she wishes someone had warned her that the test might not be worth the price she paid. Why is this happening? Partly it's medical habit. If something worked at 50, then it should be good at 75, right? But aging changes the equation. What once protected us can later burden us. And the fear of cancer, although justified, often causes people to overlook their real goals in this chapter of life: staying mobile, mentally sharp, and emotionally healthy. No screening test, no matter how advanced, is worth sacrificing these pillars for a slight increase in lifespan. At this age, it is more important to pay attention to symptoms that are actually present, such as unexplained weight loss, persistent abdominal pain, or blood in the stool. In these cases, yes, an investigation is absolutely justified. But in the absence of symptoms and with a good previous screening history, a routine colonoscopy may be not only unnecessary, but also dangerous. Here we must reclaim our freedom of action. Being informed means understanding the trade-offs, not just accepting procedures because that's how it should be. Your body has earned the right to be treated with care, not to be exposed to risks that no longer bring a commensurate benefit. The fifth point is the overuse of routine cardiac stress tests. There is something about heart disease that makes it feel like a ticking time bomb. You hear stories about someone who seemed healthy one day and then suddenly collapsed the next. Therefore, it is natural to want to identify any problems early. That's why cardiac stress tests, those treadmill or chemical tests that track your heart's response under pressure, have become so common, especially among people over 70. But here's the surprising truth. For many older people, especially those with no cardiac symptoms, these tests do more harm than good. The idea of a stress test sounds reassuring. You walk on a treadmill, they track your heartbeat, and if something looks wrong, they take action. But the reality is more complex. Most people over 70 already have age-related changes in the cardiovascular system. A little stiffness in the arteries, a little plaque here and there, or a slower recovery time after exercise. These are often normal signs of aging. But when they appear on a stress test, doctors may interpret them as red flags, prompting further research and even unnecessary procedures such as angiograms or stent placement. This is where things get risky. These follow-up procedures are not without consequences. Catheterizations can lead to bleeding, stroke, or kidney damage, especially in older people with fragile blood vessels and reduced kidney function. And once you go down that path, it's hard to turn back. One test leads to another, then to another, and before you know it, you've gone through a cascade of interventions for a condition that may never have caused you any problems. Take, for example, Harold, a 76-year-old grandfather from Illinois. He felt good, walked daily, played with his grandchildren, had no chest pain, no shortness of breath. At his annual checkup, his doctor suggested a stress test just to be sure. The test showed a minor abnormality, which led to a heart catheterization, which revealed several non-obstructive plaques. The doctors still placed a stent. After the procedure, Harold developed a complication from blood-thinning medications. He ended up in a hospital with internal bleeding and spent the next 3 months recovering. All because of a test he didn't need, based on a problem that wasn't urgent. So why is this happening? Partly it's fear, the fear of missing something, the fear of what might happen if we don't act. But at this stage of life, it's important to focus on quality, not quantity, preserving energy, independence, and comfort, rather than chasing problems that haven't even manifested. Many respected cardiologists now do not recommend routine stress tests in older people who have no symptoms. There is simply not enough evidence to support it. It does not reduce the number of heart attacks and does not reduce mortality. And for those who have no active signs, such as chest discomfort, shortness of breath with minimal exertion, or dizziness, it is not only unnecessary, but also potentially dangerous. A more sensible path is symptom-based care. If you're experiencing changes in how you feel during activity, fatigue, pressure, rapid heartbeat, then yes, an assessment makes sense. But if you feel stable, sleep well, and stay active, your body is already telling you a more accurate story than a machine. As we age, we must move from aggressive intervention to thoughtful observation. It's not about giving up, it's about living wisely. You don't need to fight every possible disease. You need to protect your time, your clarity, and your dignity. In conclusion, I want to say that aging does not mean helplessness. If anything, it is that time in life when we're finally wise enough to question the system, slow down, and ask, is this really for me? You see, in a world that glorifies more checkups, more examinations, more pills, sometimes the boldest choice is to do less. And not out of neglect, but out of a deep understanding, out of knowing your body, your values, and your goals. At this stage of life, healthcare in your 70s and beyond should not be a conveyor belt of automatic tests and impersonal procedures. It should be a conversation about what is important to you, how you want to live, and what risk you are really willing to take. Blindly following protocols designed for younger bodies can rob you of energy, peace of mind, and even years of life. Not because doctors want to cause harm, but because they're trained in a system that often chases diseases instead of honoring health. If this information has made you think and given you a new perspective on your health, then it has already fulfilled its task. And remember, refusing certain tests does not mean that you are ignoring your health. It means that you are acting deliberately, weighing the benefits and burdens, and recognizing that not every test leads to clarity. Some lead straight into a labyrinth of overdiagnosis, anxiety, and unnecessary treatment. Therefore, take responsibility, talk openly with your doctor, ask if the test is likely to change the outcome or only the documentation. Think about your time, your energy, and your comfort, because at this age they are precious. You have earned the right to live on your own terms, not in fear, but thoughtfully, not burdened by procedures, but empowered by knowledge, and not constantly preparing for illness, but actively creating a life full of meaning, joy, and connections. Let's delve deeper into the topic and consider specific examples and alternative approaches that can help you make more informed decisions about your health after 70. Let's start with colonoscopy. As we have already said, this method of screening for colon cancer is certainly important, but its value decreases with age, especially if you have no symptoms or family history of this disease. Instead of automatically agreeing to a colonoscopy, consider discussing alternative options with your doctor. One such option is a fecal occult blood test, FIT test. This non-invasive test, which can be done at home, detects the presence of blood in the stool, which may be a sign of polyps or cancer. If the FIT test result is negative, then the likelihood of serious problems in the colon is extremely low, and colonoscopy can be postponed or even canceled. If the result is positive, then colonoscopy may be recommended for further examination. Another option is sigmoidoscopy, a procedure in which only the lower part of the colon is examined. Sigmoidoscopy is less invasive than colonoscopy and does not require full sedation, which reduces the risks for older people. However, sigmoidoscopy only detects polyps and cancer in the lower part of the colon, so it may not be as effective as colonoscopy for detecting problems in the upper part of the colon. It is important to understand that none of these tests are perfect, and each has its advantages and disadvantages. The best approach is to discuss your individual risks and benefits of each option with your doctor to make an informed decision. Moving on to full body scans. It is important to note that these examinations often reveal many incidental findings that pose no threat to health. However, these findings can lead to unnecessary worries, additional examinations, and even invasive procedures that could do more harm than good. Instead of undergoing a full body scan, focus on maintaining a healthy. It's important to prioritize a healthy lifestyle and regular checkups with your doctor. If you have specific symptoms or concerns, discuss them with your doctor so they can order appropriate tests. For example, if you experience unexplained weight loss, abdominal pain, or blood in your stool, your doctor might recommend a colonoscopy or other tests to screen for colon cancer. If you have a cough, shortness of breath, or chest pain, your doctor might recommend a chest X-ray or other tests to check for lung or heart conditions. It's crucial to remember that medical tests should only be performed when there are specific indications, not just for preventative purposes. Overuse of medical tests can lead to overdiagnosis, unnecessary anxiety, and invasive procedures that may cause more harm than good. Regarding cardiac stress tests, it's important to note that these tests often produce false positive results in older adults. This means the results might indicate you have a heart problem when your heart is actually functioning normally. Instead of undergoing routine stress tests, focus on maintaining a healthy lifestyle and regular checkups with your doctor. If you have specific symptoms like chest pain, shortness of breath, or dizziness, discuss them with your doctor so they can order appropriate tests. There are alternative methods for assessing heart health that may be more suitable for older adults. For example, an echocardiogram is a non-invasive test that uses ultrasound to create an image of your heart. An echocardiogram can help identify problems with heart valves, heart muscle, or other structures of the heart. Another option is Holter monitoring, a procedure where you wear a portable EKG monitor for 24 to 48 hours. Holter monitoring can help detect irregular heartbeats or other problems with your heart's electrical activity. It's important to understand that none of these tests are perfect, and each has its own advantages and disadvantages. The best approach is to discuss your individual risks and benefits of each option with your doctor to make an informed decision. Overall, it's important to remember that medical tests and procedures should be aimed at improving your health and quality of life. If you're unsure about the necessity of a test or procedure, don't hesitate to ask your doctor questions and seek a second opinion. Your health is your responsibility, and you have the right to make informed decisions about your medical care. Don't let anyone pressure you into undergoing tests or procedures that you don't need or that could be harmful. Remember, healthy aging isn't about chasing every tiny potential problem. It's about listening to your body, maintaining your independence, and avoiding the medical overreach that can take more than it gives. Instead of focusing on medical tests and procedures, concentrate on maintaining a healthy lifestyle. This includes eating a balanced diet, exercising regularly, getting enough sleep, managing stress, and maintaining social connections. A healthy lifestyle can help you maintain your health and independence for years to come. It can also help you avoid many of the diseases that are common in older adults, such as heart disease, diabetes, cancer, and dementia. In addition to a healthy lifestyle, it's also important to see your doctor regularly for preventative checkups. These checkups can help identify health problems early on when they're easier to treat. However, it's important to remember that preventative checkups should be individualized and based on your specific risks and needs. Not all tests and procedures are right for everyone, and some may be more harmful than helpful. Discuss your individual risks and benefits of each test and procedure with your doctor to make an informed decision. Don't hesitate to ask questions and seek a second opinion if you're unsure about the necessity of a test or procedure. Your health is your responsibility, and you have the right to make informed decisions about your medical care. Don't let anyone pressure you into undergoing tests or procedures that you don't need or that could be harmful. Remember, healthy aging isn't about chasing every tiny potential problem. It's about listening to your body, maintaining your independence, and avoiding the medical overreach that can take more than it gives. Instead of focusing on medical tests and procedures, concentrate on maintaining a healthy lifestyle. This includes eating a balanced diet, exercising regularly, getting enough sleep, managing stress, and maintaining social connections. A healthy lifestyle can help you maintain your health and independence for years to come. It can also help you avoid many of the diseases that are common in older adults, such as heart disease, diabetes, cancer, and dementia. In addition to a healthy lifestyle, it's also important to see your doctor regularly for preventative checkups. These checkups can help identify health problems early on when they're easier to treat. However, it's important to remember that preventative checkups should be individualized and based on your specific risks and needs. Not all tests and procedures are right for everyone, and some may be more harmful than helpful. Discuss your individual risks and benefits of each test and procedure with your doctor to make an informed decision. Don't hesitate to ask questions and seek a second opinion if you're unsure about the necessity of a test or procedure. Your health is your responsibility, and you have the right to make informed decisions about your medical care. Don't let anyone pressure you into undergoing tests or procedures that you don't need or that could be harmful. Remember, healthy aging isn't about chasing every tiny potential problem. It's about listening to your body, maintaining your independence, and avoiding the medical overreach that can take more than it gives.